With COVID-19 rapidly moving across the state, we know many still have questions about the coronavirus and the guidelines recommended to avoid becoming infected. We are speaking with Dr. Beck from Westex Urgent Care to break down that information available so we can better understand how to do our part and protect everyone in our community. First, Dr. Beck, can you explain social distancing?
Most viral infections, such as coronavirus, are spread via respiratory droplets. So when someone coughs or sneezes, that spray, if you will, can go out 4 to 6 feet. So if you keep the distance apart by 6 feet, then there's a decreased chance of transmission.
So should we be taking extra precautions when we make trips to the grocery store or other necessary outings?
It's not a good idea to take, for a mom to go take her 2 or 3 or 4 kids to the grocery store for so many reasons. First of all, there's potential for exposing all of those people, and we don't want to get any more people out than is needed.
And because we still have a relatively low case count here in the basin, do you think people are experiencing a false sense of security?
Yes, to answer your question, I think there is a false sense of security. We are going to see more illnesses, more diagnosis of coronavirus as time goes on. I think we've only seen the tip of the iceberg. I think we're going to see many more cases. Unfortunately, our ability to test is very limited, so we have to test only the people that fit in the CDC criteria.
With the virus spreading through West Texans, many are concerned about the lack of testing and why so many people are being told to self-quarantine without getting tested. How do you feel about the lack of available tests in the area?
It's frustrating for us as medical providers, too, because I think if we had more readily available testing, we could screen people better. So what I would say to those people who are frustrated because they can't get tested is we don't make the rules, unfortunately. We have to abide by the guidelines that the CDC and the Texas Department of Health outlined for us.
And also, what about the reports we've been hearing of young people who are now being infected just as badly as senior citizens? Can you tell us why that's happening?
We don't really know why it's affecting some people harder than others. There are sometimes young, healthy, relatively young, healthy people who are getting this, and it just really hits them hard, and they get a bad pneumonia and end up on a ventilator, and we can't always explain it.
And also, labs across the globe are working around the clock to find a drug that combats the virus. Can you tell us how that research is going?
We don't have anything that has been proven. There is some somewhat anecdotal experience with a couple of medications that are actually immune modulators, medicines like hydroxychloroquine that can be used to treat, say, certain types of arthritis or autoimmune disorders. And the hydroxychloroquine, and also a lot of times people are getting treated with the antibiotic azithromycin. We don't know why, but in other countries, that combination has apparently been shown to improve their clinical outcome, or at least their clinical status. Again, that's not been laboratory tested or studied. That's a little more anecdotal, but right now we're just reaching for straws, more or less. They're also studying some of the antiviral medications that are out there, for instance, used to treat things like HIV, because they are antiviral medications, but we don't have anything yet that has been shown to specifically treat coronavirus. We're really just treating the complications or the symptoms.
And also right now, something we've been told, with the threat of the community spread, we want to keep as many people as safe as possible. If you're experiencing symptoms of the coronavirus and believe that you should be tested, please call your doctor first and don't just show up.
If you think you have coronavirus, you should call and talk to a healthcare provider some way, somewhere, before you just show up at a clinic or to the ER.
And if you would like to speak with Dr. Beck, he offers a virtual visit to all of his patients, so you don't have to come in person. He can diagnose many illnesses just by video chatting or even talking on the phone.
So the virtual visit is basically a live face-to-face conversation with a local healthcare provider. It can be accessed via our website, which is www.westexurgentcare.com.
Thank you so much, Dr. Beck. And if you have questions for Dr. Beck, please reach out to us on Facebook or through email. If you want to ask him, have him explain anything about the coronavirus that still may be confusing, you can message us on Facebook at Big 2 News KMID or email us at kmidnews@nexstar.tv.